feels like I feel like very high. Anyway, a slightly higher chair plus a pillow, combination of the two. It's not a higher chair. It's a chair I've always used. It must be the pillow. It's actually not the chair I've always used. This chair has been condemned for a long time, and I brought it back because the other chair is in a worse state than this one. Anyway, enough of the chairs. Let's get down to the business. I can't see on the Instagram. Is that Jackie? Yeah, Jackie's here. Good to see you, Jackie. Long time no see. Probably not a long time because I probably saw you last week, but you know, I haven't been on Instagram for a while. So this is a Q&A with me, Staiano, plastic surgery, the eponymous leader, and I am answering some questions. If you've got any questions, ask away. Although I can't really, yeah, I can sort of see them. I'm going to kick off if that's okay. Can we remove brown age spots? So can we? I mean, basically, we can remove anything, and brown age spots would be within that remit. But and I would say no, because it probably wouldn't be a good idea, because what we do at the clinic is surgical. We cut things out, and brown age spots are not good things to cut out, because when you cut something out, you give a scar. So I would say no. That might be something that maybe a dermatologist or some kind of skin management might be able to help or cover, but I think surgery for just some, well, it depends what you mean by brown age spots. What I'm thinking of is these sort of just slightly pigmented areas of skin. Now you could have things like lentigos, which are like freckles, which can get big freckles, and you know, they can be bad. You can get lentigo maligna, and so you can get problems with brown spots on your skin. So in those circumstances, we would. God, I should have thought this through. We stumbled on the first one. So yes is the answer. We can remove anything, but when we remove stuff, we leave a scar. So if it's just kind of like, if there's a multitude of them, and they're not particularly obvious, it's probably best not to have surgery on them. But there may be other things you could have on them, which would be a dermatologist who might be able to help you with that. But surgery would probably be too much. Something's going on in Instagram. What can I see? There's a one here. Brighter Mage Cleaning sent a request to be in your video. Brighter image. If you want to be in the video, I will say yes. But usually people do that as an error. So I'm not going to say yes, because it might panic you if I appear on your, we do a split screen. But if you want to, if you're going to ask a question live, you can. If you just post in a comment that you want to ask a question live, but I would say 9 times out of 10 that's an error. Actually, 10 times out of 10 it's an error. No one's actually really wanted to join the live video. But of course, if you do, you'll be more than welcome. So do we remove brown spots? Yes, we can, but usually just age-related brown spots. It's not something we do frequently, because we are primarily surgery. If there's one which is particularly troublesome, it might be something that we could get involved in. Do we offer lip reduction? No, we don't. I don't really do facial cosmetic surgery, so I don't do facelifts, brow lifts, rhinoplasty. So so I've never really kind of, because that's not been the arena, I never really got into lip reduction. I mean, so no, I know it is something that people, you know, it is a thing, and plastic surgeons do it, but I kind of leave it to the guys that are doing faces. I mean, I'll do moles, cysts, lumps, bumps on the face, but I don't do sort of anti-aging or you know, aesthetic facial surgery. So I feel like I'm trying to stay in my remit. So no, it's not really been something I embrace. Something's happened here. Folliculitis scarring, keloids on the back of the head, above the nape of the neck. Can plastic surgery be done? So yeah, difficult. I know what you mean there. Difficult. Probably the first person I would see would be a dermatologist, because there may be some treatments that might be prior to seeing us, what we would do for keloids in that area is silicone can help. It's a difficult area for silicone. Probably the mainstay would be steroid injections. So you can do steroid injections into keloid scars to make them less raised, particularly if they're itchy. It can really help with the itch. So that would probably be the mainstay of what we do for that sort of scarring, because it can be quite extensive. If it's just kind of one small localized area, could consider doing some surgery, but you've got to be a bit careful doing surgery on keloid scars. So steroid injection would probably be the mainstay of what we would be looking at. The other thing you've got to look at is to see, is it keloid scars? Is it hidradenitis? So you can get hidradenitis suppurativa, which is a nasty sort of inflammatory condition of the glands, of the sweat glands, and that's usually managed non-surgically, and it's only kind of late stage that it gets managed surgically. So yeah, if it's a keloid scar, certainly steroid injection would be something we get involved with, but I probably wouldn't be doing a huge amount of surgery. Put the glasses on. Augusta, hi Dr. Sam. I don't know when it was Augusta. I did my implant with you about 9 years ago. I'm very happy and proud to be done my implant with you. I recommend to all my friends. Augusta, that is a legendary, and I'm very happy and proud that you're a patient of mine. And I think of you often, and I hope you're well. And I've got to be honest with you, Augusta, I'm not doing this sort of surgery anymore. It's all been a bit too much, to be honest with you, and I am not doing the sort of breast implant surgery. I'm just focusing more now on lumps, bumps, skin lesions, mole, cysts, keloid scars, tattoo removals, local anesthetic cases that I do in my clinic. We have got other surgeons at the clinic who are doing the bigger ops, but not doing that. Having said that, Augusta, I'm always here for you if you have any questions, queries, problems, issues. I do, I've always said that I will look after my patients, previous patients, but thank you for recommending me, and nice to hear from you. Thank you. Been suffering for many years. Appreciate your insight and information. You're welcome, brighter image. It's a difficult problem. Back to the keloid on the back of the neck. Oh, here we go. Look at that. I've got a keloid question. Look at that. Straight in. Can you use laser to treat keloid scars? Personally, I mean, I don't do laser, so you might say, oh, he's biased. But I'd say speak to someone who does laser. But in my view, the laser that would be used for keloid scars would be an ablative laser, something like a CO2 laser, which basically cuts like a knife. So in the same way you can use a knife for keloid scars, because you can cut them out. As I say earlier, you've got to be careful cutting them out. Yeah, I guess you could use a laser in that same way, but not in the way that a lot of people kind of think about laser, which is more, laser is often used as a targeted energy, which has a certain thing that it targets. Like, for instance, if you have a birthmark, it can target the red of the birthmark and selectively target that. But there's nothing really for a keloid scar. But on paper, you could kind of cut it out with an ablative laser, but that would be the same as cutting it out with a knife. But there's no sort of particular target for a laser, so it's not really a mainstay of keloid scar treatment. I'm a small girl, had a surgery before, but I feel I look square. Can I have another procedure to get defined small waist? If so, what would you recommend? That's fine. Thanks, doctor. Thanks, August. What sort of thing are you talking about, Eligles? Has surgery for square. So it's the abdomen you're talking about, and you feel you look square and you want a more defined waist. Well, that's a tricky one. I would say you can send a photo, but I'm not really doing that sort of stuff anymore. But in general terms, defining the abdomen, if you're a small girl and not a candidate for a tummy tuck is kind of like the sort of go-to waist definition surgery, but you have to be a candidate for it in that you have to have enough excess skin kind of warrant or be able to do a tummy tuck. So that means that you normally, if it's for people who've lost weight or had children, so if you've not got enough skin, then it will be liposuction to your abdomen. Personally, I'm cautious with how much liposuction I do to the abdomen, because I feel that it doesn't often give great results because it doesn't remove any skin. But it can help to hold contour, especially if you're describing a square look and you might want to bring your waist in, or there might be something specific that can be done. But it sounds like a tricky one. I'll be honest with you. It's these sorts of cases are tricky when it sounds like you probably look quite good and you just kind of want to look a bit better, and those are always difficult. So it does sound difficult to me. Sorry, I can't be more specific, but it's difficult with do my best with my online consultations. These aren't really online viewpoints. How big will the scar be after having a lipoma removal? Well, that is a good question, and that is something that needs discussion, I would say, because it kind of depends on two things. It depends on obviously how big the lipoma is, so the bigger the lipoma, the bigger the scar, but it also depends on kind of where the lipoma is, because some lipomas can be quite deep. That's why often we want scans and things for lipomas, because they can be quite deep. Because if they're not quite deep, if they're quite superficial and if they're quite close to the skin, it's actually possible to remove a lipoma through quite a small incision, because you can kind of squeeze it out and it kind of pops through the skin. But if it's deep and we have to go looking for it, then that's when the incision gets bigger. So I'd normally say it's about the same diameter as the lesion. Try and make it a bit smaller, but that's kind of the kind of ballpark you want to be expecting, about the same diameter of the lesion. But if it's, as I said, if it's close to the skin, we might be able to take it out through a smaller scar, and that's particularly for people who have multiple lipomas, because you can often do little stabs and take multiple lipomas out by kind of squeezing the skin and popping them out. So it is possible to take it out through a smaller incision if it's close to the skin. So that's something we'd really need to sort of examine you for, to see where it is in terms of how close to the skin it is. Because if it's quite deep, you might need a bigger incision. Can you remove located on the forehead? What's that question? Can you remove located on the forehead? Okay, bit of a typo there. Haven't checked these. Can you remove located on the forehead if I'm taking methotrexate? I'm assuming. Okay, can you remove a lesion? We're going to say, let's just fill in the gaps. Come on, we're professionals here. We can ride this one out. Yeah, you can remove a lesion on the forehead if you're taking methotrexate. The thing about methotrexate is it's an immunosuppressant, so it suppresses your immune system, which is very good if you've got an autoimmune disease, but it's not very good if you are having surgery, because you kind of want like an immune response to heal. So you're going to potentially have delayed wound healing. So it kind of depends on what you're having removed. I'm kind of thinking it's going to be a small thing. It's not a massive thing. If it was a massive thing and a big op, then we'd have to think about it, particularly in terms of how, was the op needed? How important was it? Because you are going to have a higher risk of infection and wound breakdown. So you'd have to mix that in with the benefit of removing the whatever it is. We don't know what this thing is, but removing this thing from your forehead. So you'd have to balance that out. So it depends on how bad the thing on your forehead is. So if you think on your forehead is really bad, then maybe it will be worth it. But if you think of these foreheads not really bad and there's a high risk of infection and wound healing, you might want to reconsider it. So it's one of those things that I would call a relative contraindication. So it's something that will make you think twice. It's not an absolute contraindication. You wouldn't just say, oh, you're in methotrexate, you can't have it done, but it would be something that you would take into account. How long do you wear on an initial bandage for after pinnaplasty surgery? Once the initial bandage is off, do you wear a headband day and night, or just at night, and how long? This needs to, we do pinnaplasty at the clinic, but I don't do it. The other surgeons do it, and I haven't done it for a long time. Surgeon specific. This is kind of up to the surgeon, and you'll find that surgeons will all have different views on this, which kind of implies there's no kind of right answer to this question. So when I used to do it, I used to do a head bandage for a week and then a headband at night for a month. So, you know, so that in answer to your question, that's what I would do: bandage for a week and then the headband just night, not day, for a month. That would be my regime, but everyone's different. And it seems to me that the regime is going less bandages these days. So they're going less and less. The sort of dressings are getting less and less because a head bandage is quite a big deal, and it's quite, you know, you have to sort of hide away for a week because you kind of look like you've been in the war with your head all bandaged up. So it seems to me that people are moving away from head bandages. It does depend a little bit on the technique used. So if you're using a kind of scoring, there's two different ways of doing it. Broadly speaking, there's a way you can score the cartilage and remold it, a bit like if you have a bit of cardboard and score it, it'll like bend away from the scores. And that way you do need to perhaps that, and that's the way I used to do it. Well, I've done it both ways, but that was the main way I used to do it. And you do have to keep that mold in place. So that's when your head bandage is important. A lot of people, well, it seems to be sort of becoming more popular to use the suture technique where you put some sutures to the ear to sort of pin it back. And that you need less, it's less kind of molding. Excuse I. You don't have to deglove the ear so much and all sorts, so less of a need for the head bandage. So I think those guys are using bandages less, and sometimes it's hard to put a little dressing on the ear. It's either a big head bandage or it's kind of nothing. So but I think they're moving towards kind of nothing and maybe just head bandages and things from the start, which is certainly a lot easier for people who are having the surgery, but it is very surgeon specific. So probably my regime is a bit old-fashioned, and well, I don't know whether it is or it isn't, but it doesn't really matter what my regime is because I don't do it anymore. So it's really up to the surgeon who does it as to what sort of dressings you're going to have on there. That's it. I'm out of questions. I'm out. Obviously, I'm a busy man. Clearly, I've got a lot to do, so I've got to get on. Can't hang around here all day. So nice to see Augusta tonight. I will make myself scarce then. If you've got any questions, do please give us a ring, drop us an email or whatever, or comment on something. And you know, if you're lucky, no guarantees, but if you're lucky, you might get in for next week, next Tuesday, 7 o'clock. I am the right day, aren't I? It's Tuesday today. Yeah. Next Tuesday, 7 o'clock, I will be here with another scintillating episode of the Q&A. So I'll see you then.